The point number 6 is peptide receptor radionuclide therapy. It is used to treat the neuroendocrine tumors. Peptide receptor radionuclide is a type of internal radiotherapy. You might have it as a treatment for the neuroendocrine tumors that cannot be removed through surgery and that has spread to the other parts of the body and causing symptoms. Peptide receptor radionuclide therapy is also called radioligand therapy, molecular radiotherapy, targeted radiotherapy, radio-labeled treatment, or targeted radionuclide therapy. What is the internal radiotherapy? Internal radiotherapy means giving the radiotherapy to the cancers from inside the body. The treatment gives a high dose of radiation to the cancer but little to the surrounding tissues. There are different types of internal radiotherapy. For neuroendocrine tumors, you might have peptide receptors, radionuclide therapy, and radioactive RD. How peptide receptor radionuclide therapy works. Some neuroendocrine cells have the protein receptors on the outside of them, which are known as somatostatin receptors. The hormone somatostatin reaches to these receptors and causes changes in the cells. For example, they may tell the cell to slow down the production of hormones. Special scans such as PET scans or Peptide scans can check whether the NED has these receptors. If the NED has somatostatin receptors, doctor can use them to target the radiotherapy. In laboratory, doctor attaches a radioactive substances to a man made from hormones, somatostatin, a somatostatin analog. This radioactive treatment circulates through your body in the bloodstream and attaches to the somatostatin receptors on the NED cells. It then enters the cells and kills it from the inside. Doctors usually use a treatment called lutetium oxydotride Lutathera. Here are the somatostatin receptors and our radioactive substances. Radioactive substances attaches to our neuroendocrine tumor cells and once inside the radioactive substances damages the neuroendocrine tumor cells. When do I have peptide receptors radionuclide therapy? You might have peptide receptor radionuclide therapy if you have a neuroendocrine tumor that cannot be completely removed by surgery or that has spread to the other part of the body. Your neuroendocrine tumor must have started in the pancreas or the gut or the gastrointestinal tract. The gut includes the food pipes, which is known as esophagus or stomach, ball. Ball contains small ball and large ball. Small ball is known as small intestine and large ball is known as large intestine. Then we have rectum, which is back passage. Before the start of the treatment, your doctor also checks the neuroendocrine tumor has somatostatin receptors on its surface. You usually have a radioactive scan such as octreotide or gallium dotatate PET scan to check for this. How does peptide receptor radionuclide therapy works? Peptide receptor radionuclide therapy is a highly targeted and effective form of radiopharmaceutical therapy, which is RPT, with the minimal side effects for treating the NETs with an abundance. In peptide receptor radionuclide therapy, the patient receives an intravenous injection of drug which is octreotide and octreotide that is chemically bonded to a radioactive material which is lutetium-177. Other radiopharmaceuticals include yttrium-90 and indium-111. The radioactive drugs binds the octreotide to the somatostatin receptors on the tumor cells and tumor cells with radiation. Peptide receptor radionuclide therapy with the lutetium dotatate was FDA approved in 2018 for the treatment of gastroenteropancreatic neuroendocrine tumors. There are ongoing clinical trials featuring other radiopharmaceuticals, isotopes, peptides, and combinations with other therapies. What conditions are treated with the peptide receptor radionuclide therapy? Peptide receptor radionuclide therapy is used to treat the NATs, including the gastroenteropancreatic NATs, namely NATs arising from the stomachs, intestines, or pancreas, also known as carcinoids, and islets of the carcinomas of the pancreas, which represents the current U.S. Federal Drug Administration, which is FDA approved indication. Peptide receptor radionuclide therapy is an option for the patients who have advanced or progressive neuroendocrine tumor positive on somatostatin receptors imaging, which are radioactive tracers which are used with the PET and CT scans, PET and MR machines who are not candidates for surgery, whom symptoms do not respond to the other medical therapies. Benefits of the peptide receptor radiotherapy includes the symptoms relief, slowing tumor progressions, and improving overall survival. How is PPRRT performed? The most common protocol includes a series of 4 PRRT treatments with lutetium glutatate spaced approximately 8 weeks apart. Local protocols may vary. This therapy has been done as an outpatient procedure or may require a hospital stay of few days. In US, this treatment is performed as half or full day outpatient procedure and only in the rare cases a patient may need to stay overnight at the hospital. Each PRRT session begins with an anti-nausea pre-medications followed by an amino acid solution. The amino acid solution is delivered to protect the patient's kidney from the effect of the treatment. The radioactivity drugs is then injected into the patient, which generally take about 30 minutes, followed by administration of the additional amino acid solution. In total, the treatment session lasts approximately 4 to 5 hours. Post-treatment lutetium scans may be taken during and following the treatment processes to see where the injected radioactive drugs has traveled in the body, although this scan is not required as a part of the FDA label for treatment. What are the advantages of peptide receptor radionuclide therapy? Peptide receptor radionuclide therapy and the other molecular therapies offer more personalized cancer treatment. Peptide receptor radionuclide therapy is targeted therapy because these radioactive drugs are highly selective in their abilities to specially reach and damage the neuroendocrine tumor cells while limiting the radiation exposure to the healthy tissues. As a result, peptide receptor radionuclide is generally well tolerated. Peptide receptor radionuclide therapy is the treatment option that is highly effective in controlling advanced metastatic or inoperable and progressive neuroendocrine tumors. Peptide receptor radionuclide therapy is rarely curative but has been shown to help relieve symptoms, shrink tumors, and slow the progression of the disease. Is PRRT is safe? All the therapies, including peptide receptor radionuclide therapy, has a side effects and risks. You should discuss this with your medical provider. Your medical provider will help you to determine whether the peptide receptor radionuclide therapy is right for you given your medical history. Please make sure you will your tell your provider about any prior therapies you have received, as this can play a role in determining the correct therapy and dosage. Here are some side effects which are related to this therapy. Peptide receptor radionuclide therapy can cause side effects. These include the administration of the peptide receptor. Radionuclide therapy itself is well tolerated, but patients may experience nausea, vomiting as a result of the amino acid solution given for the kidney protection, especially with some types of the amino acids and solution. This is managed with anti-nausea medication or slowing down the administration of the amino acids. Long-term side effects can include a suppression of blood cells counts, which is mild to moderate in the majority of cases. Delayed side effects such as permanent kidney injury and appearance of the secondary blood disorders, which is myelodysplastic syndrome, are rare. Overall, the treatment is well tolerated by most patients. Home care after having this therapy. Your medical facility will provide you with the instructions for special care to be taken following treatment because small amount of radiation temporarily remains in the body. Patients need follow the radiation safety protocol provided by your faculty. This may include staying a safe distance from others for several days and careful hygiene following PRRT therapy because the radioactive truth is removed from the body mainly through the urine and feces. It is important to maintain the good bathroom hygiene during this period. Please refers to the FDA label and the manufacturer inserts for a complete list of the safety information. For additional information on travel after receiving lutetium dotatate therapy, go to this website.